All right, this is skill 2.31, administering dry powdered inhaled medication. Spiriva is a common one that's used, okay? So first of all, with any medication, you're going to check the physician's order and make sure that you have a correct order, okay? Then you're going to gather the medication from the medication room or wherever the storage area is in your facility, okay? You're going to check the medication label 3 times for safety. You're going to check it when you take it out of the medication drawer and say, yep, I grabbed the right one, okay? And then you're going to look at the expiration date, see if it's okay, all right? You're going to compare it to the MAR and say, yep, that's what I'm supposed to have, exactly. Is that it's the right med, it's the right dose, it's the right time, it's the right route. Okay, yep, okay. Don't forget the 6 rights to your patient medication, okay? Don't forget that. And then you're going to compare it to the MAR in the client's room or when you're ready to leave the medication preparation area, okay? You're going to go to your patient's room and you're going to perform WIPSA. Now, you're going to be dealing with the mouth again, so it's okay to put on gloves. So go ahead and put on your gloves, all right? And you're going to assist the client to a comfortable sitting position. It's easier for a client to inhale when they're sitting up, okay, than it is to be laying down and trying to inhale, okay? So how do you use the dry powdered mechanism? Okay, it's going to look, this is a Spiriva inhaler, okay? It looks like this. Looks just kind of, oops, kind of like an egg, right? Okay, so it's closed, and then what you do is you just pop this open, okay, and if you look, that's where the patient's going to put their mouth around and breathe in, okay? But first of all, you need to put the medication in there, okay? So what you do is this pops open here, this white part, so you just pop it open, okay, just like that. And then that's where the pill will go that we're going to pop there. Now when we push this green thing right here, when we push it, oh, I don't know if you can see it, there's a needle inside that'll go and will pierce the pill. It's a capsule, okay? Yeah, the capsule looks like this, okay? And I don't know if you can see the piercing. Can you see that piercing in there? I'm trying to hold it right. Okay, there we go. There's a piercing on there, okay? And when it pierces it, what it does is it allows the patient to breathe up through this screen that's there. The medication will come up through here and they'll be able to breathe it in, okay? All right, so that's the inhaler. So you're going to assist that client to a comfortable sitting position. You're going to remove the capsule from the package, and the capsule looks just like this. I mean, the packaging looks just like this. And you just open it up here, okay? On the side, you see how you can just pull that apart? Okay. So you take the pill out, the capsule out, okay? You take the capsule out, and you put it inside of that hole, okay? It only can go in lengthwise, okay? And then you're going to close this white part over, okay? Close it over until you hear it snap, okay? And then it's still not ready to give to the patient, okay? You want to make sure that you pierce it. So you push this green thing. Did you hear that? Okay? It's going to sound like that. You're going to pierce that medication. And then what you want to do is have them hold on to the thing just like this, or they can hold on to it with both hands like this, okay? And they're going to put it around, they're going to put their mouth around that piece, okay? And they're going to put their lips around it really tight, okay? And then you're going to have them breathe out completely. Put their mouth around the mouthpiece and breathe in slowly and deeply with sufficient energy to hear the medication capsule vibrate. So I'm going to put my fingers there and I'm going to try to see if I can get that to vibrate. Hold on. No, it's not. Okay. ugh, sorry. If they breathe in slowly enough, you will hear this capsule inside hitting on it, going tick, 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 tick. Okay, and you want them to breathe in slowly and deeply, so it's going to be as far in as they can get it. Okay, and then you're going to have them hold the deep breath as long as comfortable. So it's hold, and then just return to a normal breathing pattern after that. Okay, if you feel that they did not get all of the medication with that one, it doesn't hurt for them to put their lips back around and breathe in again to make sure that they get all of the medication, the dry medication, out of that pill. Okay, when they're all done with this, what you do is you remove the pill from inside of the thing and you put it in the garbage. Okay, and then you take this and you're going to clean off the mouthpiece. Okay, clean it off. Alcohol, tissue, you know, alcohol is probably the best. Okay, and then you're going to close the container and you're going to store it back in it wherever you keep it. Generally, they like to keep it in the same box as the medication. So you put the inhaler back in with the medication, and then you would store that wherever it is in your facility that they store it. Okay. You're going to remove your gloves. You are going to make sure that the patient is comfortable. Do all of your necessary wipes kind of things at the ends, and then you're going to wash your hands and you're going to document anything that you just did for the patient. Okay, so that is skill 2.31, administering dry powdered inhaled medication.